name's Vicky, and I've got the great opportunity to welcome you to this session on finding out more about chemotherapy in the treatment of cancer. We're fortunate enough to have Louise Watkinson, who's sister in the oncology outpatients at Poole, part of University Hospital Dorset, and her colleague Mandy Brampton, who is a specialist nurse in cancer at Royal Bournemouth Hospital. They'll also be joined later by Hayley Merrifield, who's part of the pharmacy team at Poole. So, as I said before, your cameras are turned off and your microphones are muted. Please do put any questions or comments, any queries in the chat box, and we can direct them to our speakers. So without further ado, I will hand over to you. I think it's Louise, you first. Thank you.
Hi, it's Mandy who's going to present first, but welcome to everybody. Thank you for coming along this afternoon and attending. So myself, Mandy from Bournemouth and Louise from Poole. We thought we'd go through with you and show you our Welcome to Understanding treatment workshop that we present to patients from Poole and Bournemouth who are going to be having treatment with us on our oncology units. So next slide, please, JC. Can we have the next slide, please? Thank you. So in the presentation we give, what we hope to cover for patients is the general chemotherapy side effects that you may experience, how to seek help with us if you need it, to give you some tips and advice on how to care for yourself, and just some other important information about treatment and support available in the Bournemouth and Poole area. Next slide, please. So just briefly, what is chemotherapy? Well, it is a drug treatment to combat cancer cells. Yes, it is cytotoxic, and it causes damage to rapidly dividing cells in the body. Now, those can be the cancer cells, but they can also be some of the healthy cells that we have, and Louise is going to speak more about that in a moment. It can cause side effects, the same as any other medication. And we talk about chemotherapy being delivered in cycles, and it can be given in tablet form, injections, or infusional form. But the thing to remember, it's all equally as strong and potent. So next slide, please. So how does it work and cause the side effects? Well, whichever way you're having your chemotherapy, whether it's infusional, injection, or tablet form, it makes its way into the bloodstream and circulates throughout the whole body. And as I said before, it damages rapidly dividing cells within the body, includes the cancer cells and some particular types of healthy cells. The chemo leaves the body very quickly through all our bodily fluids. Cells that have been damaged then die, but they don't die all in one clump. They die at different times. So that is why side effects can happen over a period of time, not all at the same time. But the key thing is our healthy cells repair themselves. Next slide, please. So if you are going to be having infusional chemotherapy, it's given into a vein. So it is important that the nursing staff and our nursing staff will assess your veins prior to starting chemotherapy, because we don't want to run the risk of what we call extravasation. That's where medication can leak out of a vein into the surrounding tissue. Some chemotherapy can make the veins sore and cause pain during infusion or afterwards. So we always ask anybody with us on the unit just to let us know if they're experiencing any pain, and we come straight across and have a good look at the area. And you must report to a nurse at the time, or as I just said, or via what we run, which is a patient hotline afterwards. Sometimes people's veins have had a lot of use because they've had other procedures or been in hospital before, and we do make a point when we're examining patients and their veins to talk about, if necessary, offering alternative access devices such as the PICC line or possibly a Hickman line. But this is something that's available to help certain patients when they're having treatment and would always be discussed with you individually.
Next slide, please. So the healthy cells that we were talking about are the red blood cells, the platelet cells, and the white blood cells. And all of these are damaged by chemotherapy, but they will repair themselves. Next slide, please. So the red blood cells carry the oxygen around the body. So if they're really low, you might find that you feel quite short of breath because obviously you're not getting the oxygenation into your blood system. You might find that you feel quite tired and lethargic because obviously your red blood cells are slightly lowered. You might find that you become, people might say to you, well, you look a bit pale and pasty, you look a bit, and that's where we get the anemia, the look when people say, you know, you don't look very, you haven't got the colour. And that's because the red blood cells give you that colour pigmentation as well. Next slide, please. Now, platelets are responsible for the clotting factor in your body. So if they are low, then they can cause a nosebleed. They can cause bruising. So you might go to bed one evening, lay very heavily, wake up and you've got a lovely bruise on your arm. You might find that you're cleaning your teeth and your gums start to bleed. And that's something that, you know, not normal for you, but that could be because your platelets are quite low. You might find that you're just peeling the carrots, you cut yourself and your finger starts to bleed like you would normally, but it takes not a couple of minutes, it might take a little bit longer, even up to 5 minutes where you're trying to stop the bleeding because obviously your platelets are low. All of these things we are keeping an eye on with a blood test. So, we are keeping an eye as well, but if you see these things, then we would need to know about it. Next slide, please. But it's the white blood cells that are really important to have some understanding, especially when you're having chemotherapy. So being a student nurse a long time ago, my last piece of work was about the white blood cells. So how I understand how they work is if I had the common cold and I'd feel unwell for a couple of days, but my army of defence, which is my white blood cells, would come out in their thousands and thousands and they'd help fight off the common cold. So eventually I'd start feeling better and then the cold would disappear and I'd start getting back to my normal self. But we've given you chemotherapy. So at some point we need to eradicate the white blood cells. So we say this usually happens around 7 to 14 days post chemotherapy. What happens is that's then when you're more at risk of infection. That doesn't mean that you can't go out and about and do things. This is a point of where you can actually have a conversation with your friends and family and actually say to them, I'm actually at risk of getting an infection. So if they've got a stomach upset or a nasty cold or anything that they could give to you, this is the point where you can actually say to them prior to starting your treatment, obviously I don't want to catch anything because obviously I am susceptible. And then you're giving people an understanding. Next slide, please. So what are these things that we're talking of risk of infection? So the first thing is if you're feeling unwell or you have a fever. So the first question I'd ask is, does everybody have a thermometer at home? Because the first question that they would ask you when you're ringing the patient hotline number is, what is your temperature? So we recommend that everybody purchases a thermometer. Now, we don't need anything fancy. It doesn't have to be an expensive thermometer. It can be something that's, literally £5, as long as it's one that you can use orally and not the ones that you use on your forehead, because we know that they're not as efficient. So if you're feeling unwell or have a fever, we'd want you to ring the patient hotline number. If you're feeling shivery, we'd want you to ring the patient hotline number. If you're having hot or cold sweat, we need you to ring the patient hotline number. If you've got a sore throat, if you had one episode of diarrhea, now that's not, one episode, I don't want to bother the nurses. That's as soon as you have diarrhea, we need to know about it. Because what we found is that once we know, we document it, and we would ring you back to make sure that everything's okay. What we found is that with certain patients, if they do get diarrhea, they find themselves can get very dehydrated very, very quickly. So we need to be on top of that, and we need to know what's going to happen. If you have a burning sensation when you pass urine, we want you to ring the patient hotline number. If you've got a cough, a productive sputum, or you're feeling breathless, we'd also want you to ring the patient hotline number. If you had a sore, boil, spot, anything that's red or hot to touch, that's another reason to ring the patient hotline number. If your temperature is 37.5 and above, we need you to ring the patient hotline number. If it's 35.5 and below, we also do, because you can have a temperature, a risk of infection with a very high temperature and also with a very low temperature. So you're asking, what is this patient hotline number? So to all our patients, we give them a card, and this card has your name, your hospital number, the consultant you're under, and the treatment that you're actually having. The telephone number is a mobile telephone number, and at Poole Hospital, it's manned Monday to Sunday, 9 to 5, in our open access unit. At 5 o'clock, it's handed over to a specialist nurse who's qualified with chemotherapy, and they work on either Sandbanks ward or Dalston ward, and they will answer the phone. What we say to you is that if they don't answer the phone within 30 minutes, please ring again. You must leave your name and telephone number on the line, because it's obviously we need to get back to you. Please, no matter what time of day or night, please ring. If it's 4 o'clock in the morning, that is what we're paid to be, is for you to ring us and let us know. How I look at this card is, if you were in hospital and you were unwell, you would ring your call bell, and a nurse would come and they would be there for you. Because you're in the community, you don't have that. So this is your call bell to let us know that you're unwell, and for us to give you some advice and also a peace of mind. Now, you may be looking at all of those things that I've said that are a risk of infection, but actually some of you probably might be thinking, do you know what? I've already got some of those symptoms already. What do I do? So what we say is, if they become exacerbated for you, then we need to know about it. So if you've already got, you already suffer with diarrhea, and you go 2 or 3 times a day, and all of a sudden you can't make the toilet, it's things like that, then we need to know about it. So it's really, really important that you keep in contact with us and let us know what's going on. And please always feel that you can ring the patient hotline number. It's really, really important. Next slide, please.
There are just a couple of differences between having your treatment at Poole and Bournemouth, and as Louise has just said, please ring the hotline. It's just the number for the hotline in Bournemouth is different, and you can see it on the slide here. But as Louise has said, it is at Bournemouth as well, 24 hours a day. And please don't hesitate to ring. That's what we're there for. Also, I know Louise is coming to cover this a little bit more further on in the slides for Poole. At Bournemouth, when you receive your appointments, you will be notified that a blood appointment has been booked for you to have your bloods taken, and also because prior to coming into Bournemouth or Poole, we are at the moment having to ask you to have COVID swabs taken. Your appointment would be given to you for your COVID swab at Bournemouth. You won't have to phone anywhere. Also, always please, if you had any side effects or you're feeling unwell or you've got any concerns, please call the hotline. Please just don't turn up at Bournemouth Hospital, because at Bournemouth we don't always have doctors that can see you immediately, and it might be that we need to get you to go to Poole Hospital anyway. So it will save you time and effort, and you will get answers much more quickly if you phone the hotline at Bournemouth, if you're having treatment at Bournemouth. Sorry, Louise, you're going to say something.
I was just going to say, for Poole Hospital, if you needed to make a blood appointment, you would ring our mobile telephone number, which we give out to all of our patients. It's a special number that you ring directly. It's a mobile telephone number, and you ring that telephone number. You have an individual appointment made for you with a time slot, and you will come in for that time slot, have your bloods and leave immediately. When you also ring up, we also do COVID swabs in the oncology outpatients. So what we do is we link them both up with your blood test. So you only have to come into the department once, which is really beneficial. So if you're on 3 weekly chemotherapy and weekly, you can come in 2 days before your treatment, have your COVID swab, your blood test done, ready to start your treatment. Now at Poole Hospital, phlebotomy is open from 8 o'clock in the morning until 4 o'clock in the afternoon. And on a bank holiday, it's open from 8 o'clock till 1 o'clock. So there's always somebody there. We've pretty much covered everything. If you're having bloods, your treatment on a Monday, you would come in on the Friday, and that's been agreed by the consultants and the pharmacists.
Thank you. And just something else as well, just a small difference with Bournemouth. Our specialist social worker is called Brown Morris. He is an absolute font of information and can help you work out if you are eligible to claim any benefits whilst you're on treatment. And also he's got a wide knowledge about different sort of financial aspects of going through treatment. So it's well worth tapping into him, and just by talking to either the oncologist on the unit, or asking at reception when you're there, or asking the nurse who's giving you your treatment, you can be put in contact with him. And one of my roles when I'm not doing this or any other patient information groups is I am available to offer psychological and emotional support for patients. Next slide, please. So going back to some of the side effects you may experience when you're having treatment, and I think it's important to say you are not going to experience every side effect that we talk about this afternoon when you're having treatment. It's just that you're all wonderful, unique individuals, and we don't know what you may experience. And try and think of information as power. If you know what to look out for, and we've told you about the hotline, you've always got somewhere you can phone for advice and support. I think sometimes when people think about having treatment, chemotherapy, they think about nausea and vomiting. And in the last few decades, there have been tremendous strides made in this area. An awful lot more is known now about why people vomit. And the pharmaceutical industry hasn't been slow in coming forward and inventing some very effective anti-sickness drugs. On the day of the treatment, if you're having the treatment given through an intravenous infusion line, there is a port on that line, and a very strong drug, anti-sickness drug, will be given via that line prior to you starting. And the girls who are giving you your treatment, the chemotherapy nurses, and the gentleman giving you the treatment, and explain to you about the anti-sickness medications that you're going to take home with you, so you know exactly how to take them. And these medications and these injections that you're given prior to having your treatment work very well for the majority of people. However, if you do have any nausea to such an extent that you can't eat or drink normally, or you do actually start vomiting, it is really important that you call the hotline, because we don't want you dehydrating. And in this day and age, there's no reason to be at home experiencing these nasty side effects when you can phone up and get help from us. Just for sort of general nausea, some people find ginger very effective, particularly in the form of biscuits or tea or drinks. But please don't go and buy the ginger capsules from the health food shop, because they enter the blood system in a different way, and we'd need to check with your oncologist to see if they were happy for you to take those. Very often people find that changing the way they eat, still trying to eat a well-balanced, healthy diet, but maybe breaking that down into eating healthy snacks little and often. And of course, if you are a diabetic coming into treatment, you really need to have a good discussion with your oncologist about your diabetes, how your diabetes is controlled, And obviously it's really essential that, particularly if you aren't able to eat or drink in good amounts, or you're vomiting, that you make contact with us so we can give you the advice that you need. We have found, as I've said before, that for most people, what we've got in place already works very well. But if you did need district nurse support in the community and for the nurses to be able to come out and give you what we call intramuscular anti-sickness injections, we can arrange that as well. So please, any sickness, contact the hospital because there are lots of other medications that we can try. We always get there. Sometimes with some patients, it just needs sorting on a more individual basis. Right, there is no stone left unturned in this talk, so I'm going to move on to bowels, because all the cells, right from your mouth all the way down through your gastrointestinal tract, are fast-dividing cells. So that is why...
Next slide, please.
Oh, thank you, Louise. That's great. I've got my wingman here. So that is why the gastrointestinal tract in total can become disrupted. So I'm going to talk about constipation first. So I'm sure you all know your bowel habit, and you probably might be able to identify if you're becoming constipated. Certainly if that constipation was including abdominal symptoms like griping pains or any abdominal distension, or sometimes people have described it feeling like a drum, really distended, you do need to call us in. One of the things you can do to help yourself is drink plenty of fluids. We should all be drinking about 2 litres of fluid a day, but you know, if you are constipated, try and up that to about 3 litres. And it is a good idea to start this the day before treatment and keep this going at least the sort of treatment day, and for about 2 or 3 days afterwards. It also helps flush through your kidneys as well. Eating a good and well-balanced diet can help. Also, exercise and walking and just being active sort of helps our whole system, but does have an effect on our gastrointestinal tract and the movement within that as well. But if you know you are constipated, please be in contact so that we can talk to you about medication that's available to help you have your bowels open. So don't suffer, please contact the hotline. The other thing that we talk a lot about when you're having treatment, and Louise has touched upon this as well, is diarrhea.
Next slide, please.
Thank you. We do not want you suffering from diarrhea, you know, because again, there is the risk of you becoming severely dehydrated. So if you have, and what I mean by diarrhea is loose watery stools, if you have one episode of loose watery stools, please call the hotline to update us. And then, as Louisa said before, we know and are aware you have made contact, and we can start working through with you how we're going to deal with this and how we're going to help you deal with this. Obviously, if you have an ileostomy or colostomy, you know probably you might be in a sort of settled routine in there. So take it as your basis, your baseline before you start treatment. But if you notice increased volume or maybe a sort of different consistency, but it's enough to worry you, please contact us. Also, if you've got abdominal pain, please contact us. But it is key as well, as I've said before, to keep going with at least 2 to 3 litres of fluid a day. We do have medication available, which is another reason to be talking to the hotline. But please, it should only be taken under medical advice. So if you're given any of this medication to take home, I'm talking about Imodium or loperamide specifically, please call in so we can talk to you before you start taking it, just in case we think there might be an infective element to your diarrhea and we need to ask you in to get a stool specimen for you. So I know we keep saying this, please contact the hotline. I'm going to hand over to Louise now.
Next slide, please. So with most treatments that we give you, there is an element of risk of having a blood clot. So having cancer and anti-cancer treatments does increase this risk. If you have any of these symptoms, you must report this to the hotline number. If you have swollen limbs, and that includes your legs, the backs of your calves, your arms, if they become swollen, discoloured, if they become painful, throbbing, hot to touch, all of these things could be that you have a sign of a blood clot. If you find that you have a sudden onset of shortness of breath, that could also mean that might have a clot in your lungs. All of these things, as long as you tell us these symptoms, can all be rectified with medication, and we can sort it out for you, but you need to ring us and let us know that you've got these symptoms. So it's not for you to worry, but it's for you to communicate and let us know so we can do something about it. Next slide, please. So caring for your mouth is really, really important. So it's a really good idea to make sure that everybody has really good oral hygiene. So we recommend that you brush your teeth twice a day. Now, most people brush their teeth twice a day, but actually you might not necessarily brush your teeth if you've got a really, really sore mouth. So when I say a sore mouth, you might find that you have, got ulcers in your mouth, that your mouth might be very dry, that you've got a coated tongue. You might find that it's very tender, and sometimes it can be really, really sore. So sometimes you might just think, oh, do you know what, I can't bear to clean my teeth today. So when that actually happens, we do say to use a soft toothbrush. We go as far as saying a children's soft toothbrush, because it's more likely that you would clean your teeth even if it's just for a short period of time. Only obviously use the soft toothbrush while your mouth is really sore. Once it starts getting better, because it will, then obviously go back to using your electric toothbrush or your harder toothbrush. Now, for the majority of people, we do recommend that you use a mouthwash, especially after you've had meals. And these can all be prescribed free on your prescription. We do say a non-alcohol mouthwash, because obviously if you use anything a bit stronger, it would really hurt your mouth. And your GP or your consultant could prescribe them for you. Now, dental checkups are an excellent idea to do before you actually start your treatment, and to go and see the hygienist. But if that's not possible, then obviously you can still go to the dentist whilst you're on treatment, but it's something you need to discuss with the doctor if they want you to have treatment. And also you need to tell the dentist that you are having chemotherapy. And the reason for that is that way back in the slides, I spoke to you about your platelets. Actually, if your platelets were slightly lowered and they decided to give you a fill-in or an abstraction, we might be in a little bit of trouble. So we really need to have those conversations before you actually get there. Obviously, if you had toothache, we would tell you to contact the patient hotline number, because that's an infection risk. We have our own max factor in the hospital, so you wouldn't need to have to go through your dentist. We would actually get it looked at ourselves, because obviously it's an infection risk and it's something that we would need to look and make sure everything was okay. Next slide, please. Now, for some of you, depending on what treatment that you're actually having, you might find that you get a metallic-y taste in your mouth. This is common if you're on the platin-based chemotherapies, such as oxaliplatin, cisplatin, carboplatin, and all of these can give you, it does taste like metal in your mouth. When I spoke to people prior to doing this presentation, a lot of people said, as long as you had food that wasn't completely bland and plain, then, and it had like a herb or a spice to it, actually the taste wasn't that bad and it didn't put you off your food. One gentleman did share with me that he used to suck a sherbet lemon, and that did take the edge of the metallic-y taste. So there's lots of things and lots of ideas that people have spoken to us about and said to us that this is what happens. If you do have, you do lose your appetite a little bit, we do say to you, do you know what? Eat what you fancy, even the bad stuff. So if you want to go and have a nice cup of tea and a nice cake, then that's absolutely fine. Eat little and often, not necessarily put yourself down for big meals. So sometimes just little bits, some snacks and things like that is a good idea. Just as long as you're still eating. Treatment steroids, when you are on chemotherapy, we may give you a very small amount of steroids before you start your treatment. And the reason for that is obviously that steroids are good for a lot of reasons. They can help, they are an anti-inflammatory, they also are very good with anti-sickness, and they do work alongside with the chemotherapy really, really well. What steroids can do sometimes is mess about with your blood sugars, and they can increase them. So when we do your blood tests in our department, we automatically tick the glucose box, so we are monitoring your blood sugars. But obviously, if you're a diabetic, then obviously we would also monitor your sugars more closely if you did need to have the steroids to go alongside your treatment. For those of you that might go off your food, obviously we can give you dietary supplements, such as build-up drinks, 40 juice, 40 sips. Please do not go and buy any of these. These are all we can get on a prescription for you for free. How we do that is via a dietitian, which we can get you referred by your specialist nurse or by the consultant, and they would be able to have a chat with you, talk to you, and actually get all of that set up, which is really, really important. Now, alcohol is fine in moderation. So if you want a glass of gin at the moment, isn't it? Or a glass of beer every now and then. Occasionally, it's absolutely fine. The difference is it might taste a bit different, but in moderation, it's absolutely fine. Next slide, please.
So, on to skin and nails. So you might notice some changes in your skin when you're going through treatment. And one of the things that people mention is that their skin can become sort of very sensitive and dry. So if you do find that happening, it is a good idea to have in some unperfumed body moisturizer that you can use. I'm saying unperfumed. If you've got something with a perfume in that you love, try it. But if you get any sensitivity to that at all, do swap it for something that's unperfumed. You shouldn't really experience dryness to the extent that you've got blistering and cracking on your feet or on your hands to a large extent. If that's happening, you need to be onto the hotline so we can give you advice. Maybe get something that's a lot more emollient prescribed. You should never experience any blistering, and you should never feel systemically, that is, you shouldn't feel unwell with it. If that's happening, it's a quick call to the hotline. One thing to protect your hands, because it's a good idea to be using moisturizer on your hands, is to wear rubber gloves when you're washing up, or if you're doing any housework around the house, because even with housework around the house, when you're using the chemicals, they can get off the cloth onto your hands, or if you're spraying something, you can get this aerosol effect on your skin. I think maybe now summer is over, but it will come again, and we might yet maybe have some wonderful sunny days. But out in the sunshine, you will find that you can burn a lot more easily. So please use a high factor sun cream, SPF30 or above. It's a good idea to wear a hat, and maybe if you're going out for a lovely day with friends and family, then take a light shirt or blouse with sleeves in so you can slip that on. Nails can become brittle, break easily. Sometimes they can become discolored or a bit ridged or pitted, tender and sensitive. So again, it's about keeping probably your nails short, phoning in if you think you've got any redness, what I call it, the tip of the nail, the cuticle, any redness or swelling in that area, just in case you've got an infection on board. So please, any sore skin or nails, again, it's contact the hospital via the hotline. Next slide, please. Thank you. I think people also think, when they think about chemotherapy, about hair loss. Now, not all chemotherapy causes hair loss. And I know that both at Poole and at Bournemouth, we give out the Macmillan regimen sheets of the particular course of treatment that the doctors have selected as being most appropriate for you. And if you look through those sheets, in the hair loss section, it will tell you if you are likely to lose your hair or not. Hair usually grows back after chemotherapy is completed. It is very, very unusual for people. And in fact, I've never seen it. I've only heard it reported. I've never ever seen it in all the years that I've worked on the unit.
And that's a lot of years.
Yes, a great many years. Louise, have you ever seen that either? No, we've never seen it. So, be reassured on that fact. Hair can begin to thin in about the 3rd week after your first chemotherapy, but again, this can vary, and the scalp can become tender. I know that probably on both units, we've got the Macmillan book. It's about how to cope with hair loss, which has got some excellent information on it. So do ask, because we can supply you with this information. Scalp cooling is available on both units. It's not suitable for all chemotherapies, so do have a chat with your oncologist, and if you're thinking about it, we can get some extra books and information to you. At both centres, NHS wigs are available, and everybody is welcome to have a wig referral, because even if some regimens you're just experiencing hair thinning, what is, it's very, very personal, and even slight hair loss to some patients can make them feel uncomfortable and make them feel like they want to access the wig. So, ladies and gentlemen on treatment, everybody is welcome to have a wig referral. It's done slightly differently at both sites, but it will be explained to you at the time. Other options are using hats and scarves and bandanas, and again, there's lots of information available on those. So whatever, please ask for advice, and if you would like a wig referral, please ask and we can make that referral for you. Next slide, please. Fatigue. I think fatigue is potentially one side effect that people might find they experience to a greater or lesser degree. But one thing we know about fatigue is that it can be helped greatly by balancing rest and exercise. So I know it sounds counterintuitive, but when you're feeling fatigued, to actually keep sitting and doing nothing can make it a lot worse. So just getting up and within your own range of capabilities, taking some gentle exercise, and if you can outside, particularly if it's a nice day, just to walk out in the fresh air when it's safe, can really help. It lifts the moods, lifts the spirits, and we know that exercise can help you with regaining your energy levels in between treatments and when your treatment is completed as well. Sometimes people find that by keeping a diary, you might notice that you're able to begin to assess when you're likely to feel most fatigued. And this can help you plan your life so that you know when to plan the days when with care you can see people or go out and do things. I know also when you're fatigued, it is just so easy to adopt really bad eating habits. And yes, a little of what you fancy can really do you good, and I'm not contradicting that. But sometimes if you know again that on certain days you're going to be feeling very fatigued, if you could have some meals already prepared, it can really help you. But do let us know how this side effect is for you, because fatigue is something, it's a bit of a nebulous side effect, but it really does exist. And we have some tricks and some ideas up our sleeves that can help you, but just a little bit too much to go into on this slide alone. So it's about adjusting to a new temporary normal. Next slide, please.
So you are going to have good days and you're going to have bad days, but you're going to have more good days than you are bad days. And I think that's something you should really think, that's a positive thing. If you're not, then we need to know about it, because that's not what we're expecting. We are expecting more good days than bad days. If you did need some psychological help, it is available. At Paul Hospital, we have our own counselling service. Now, that can be done as a face-to-face, which you can book. We have all the leaflets and everything here, which you can actually book yourself now, or you can do it as a Teams meeting. So either way, whatever you prefer, that's what we can sort out for you at Paul. Obviously, Mandy helps with the psychological support at Bournemouth. So at both sites, we both do something. Complementary therapy is available at both sites. Poole Hospital have just had some new people start, so that will be up and running in the next couple of weeks. And that's things like reflexology, aromatherapy. All these things can happen whilst you're having your treatment. So not necessarily the first time, but when you come and you can say, oh, I'd like to book in some aromatherapy or some reflexology, that can be sorted when you actually come for your treatment, which is really lovely, and it smells delicious on the department. It's really, really nice. It's nice to see. Next slide, please. So we do have a Look Good, Feel Good masterclass, and basically this class helps with, well, after you've had surgery, hair loss, emotional feelings, and it's absolutely fantastic. Obviously, it used to be a face-to-face class that that beauticians and support workers used to put on, and they used to help you, show you how to do your eyebrows and to do your makeup. They also gave you a very, very nice goodie bag that is worth an awful lot of money. But at the moment, because of COVID, we're doing virtual classes, and I only looked the other day, and actually there's a class nearly every single day specialising in eyebrows, skincare, all these things. So it's really, really a fantastic thing, and hopefully at some point we'll get this back as a one-to-one, because the ladies that actually did come absolutely benefited. It's an hour, they had a cup of tea, a biscuit, and just spoke to people like-mindedly that were going through treatment. So it's a really special class that we do put on, but obviously at the moment it is as a virtual class. So being sexually active is fine when you're on chemotherapy, but you would need to wear a condom. So if you're a female and you have a male partner, you would need your male partner to wear a condom, because obviously with the chemotherapy, we, like I said, right at the very beginning, through all bodily fluids, that's how you get rid of your chemotherapy. So you need to protect your partner. Obviously, if it's a male, you would need to wear a condom as well. We recommend that you utilise contraception for at least 12 months after your treatment, obviously to prevent pregnancy once receiving chemotherapy. So gentlemen can have sperm banking. This is available, and this would need to be undertaken prior to chemotherapy. And the ladies can have IVF or embryo storage, but this would need to be scheduled prior to chemotherapy, and also dependent on whether you've had children already. So it's something you would need to discuss with the consultant. Next slide, please. So in having cancer, we know can be really expensive. So we do have our resident social worker at Poole Hospital called Leo Emmers, and he can help you with financial support, emotional support, but also with your finances. He can also refer you to the Macmillan financial support, and they can help you with your finances as well. We've got the Macmillan Cancer Support Group, support book, which is called Help with the Cost of Cancer booklet, which is really good. So there's lots of things that we can help you with. And if you speak to your specialist nurses, we can refer you to the right areas to give you that support. Next slide, please. So at Poole Hospital, if you're parking in our hospital, you get capped at a 4 hourly rate. So it works out about £2.80 that you would have to be. So if you were here for the day, then obviously you'd only pay for 4 hours. And how you would do that is that you would go to the Dorset Cancer Centre, you'd speak to the receptionist as you've got there, said that you were going to park the car there, and they would give you a form, and every single time you came, you fill the form out, take it to the car park office, and they would only charge you for 4 hours. Now, the surrounding area of Poole Hospital, we do have quite a few roads that actually do have 2 hour parking for free. So that is another option that we do have. Obviously, because of COVID, you're not allowed to have anybody come in with you to have your chemotherapy at the moment. So at Poole Hospital, the new entry site, you can drop off and then you can wait there for up to 15 minutes afterwards. So especially on the first time you have your chemotherapy, we'd recommend that someone brings you and picks you up and actually they could drop you off and then come back later. And literally where the Dorset Cancer Centre is, it's right next to Costa Coffee. So it's literally at the main entrance and you'd walk straight out. At Bournemouth, they actually get free parking. So if you're having treatment or a pre-chemo appointment, but if it's for a scan and things like that, you do have to pay for it. All prescription charges are exempt. So you don't need to pay for any prescriptions whilst you're on treatment. So that's really important. There are lots and lots of support groups. At the moment, because of COVID, they're not a face-to-face or a physical support group. But I think eventually these kind of things are going to be reopening up when we've got more space and we can actually allow everybody back in again, because they are really, really important. Next slide, please. So on balance, this should be a manageable experience. No side effects should interfere with the enjoyment of your everyday life, and accept this as your new temporary normal. And that is the end of our presentation. Thank you for listening.
Thank you so much, both of you. My goodness, how much information was there in there. I know that Stephanie had a question about when you were talking about constipation and diarrhea, and she asked, are loose stools common in a patient following a gastrectomy?
No, yeah. Has the person, sorry, I didn't catch the name of the person asking the question.
It was Stephanie. You can always look in the chat. Yeah.
Right. I have to say myself, Stephanie, to be completely honest with you, it's not something that I have a lot of experience in. I don't know about Louise, but I think if she's concerned, then she really needs to contact her specialist nurse and have a word with them. You know, especially if she's experiencing a lot of loose stools and, you know, it's very watery. I think it would be, would you agree, Louise?
Yeah.
You know, important to contact her specialist nurse.
Okay, thank you for that. Stephanie, I hope that helped in some way to answer your question. If you've got a secondary question, please do let us know. I know Stephanie works at Dorset County Hospital, and she did post the DCH hotline number just after you were talking about yours, so hopefully people can have access to that as well. I thought that was really, really comprehensive. Thank you so much. Has Hayley joined you?
Yes, she has. We'll move out the way. Our lovely Hayley. What am I saying?
Hello, Hayley. I will let you introduce yourself to the people attending, and we'll move the slides on as you say so. Okay.
Thank you. So my name is Hayley. I'm a pharmacy technician in the aseptic department at Paul Hospital. The lovely green wall on the picture is where I live Monday to Friday. Next slide, please. So I'm just going to tell you a little brief bit about what happens in the aseptic pharmacy and how your prescription is processed. So once you've been seen by your consultant and your treatment has been prescribed, it is the responsibility of the pharmacist to screen it and make sure that it is clinically appropriate for you. We check details with your height and your weight, the correct dose, and any drug allergies you may have. Next slide, please. Once that prescription has been screened by our pharmacist, it gets passed on to our technical team, and we will do all of the prep work behind the prescription. So we'll create worksheets for items that we need to manipulate and make. We'll dispense all of your supportive oral medications, and we'll dispense anything else that needs to go along with that prescription, ready for you to have on your day of treatment. Next slide, please. So before you have your treatment, we will need to have a recent set of blood results. Now, for most patients, those blood results will need to come from the day before, but each regimen at each patient will have slightly specific requirements, which you'll be informed of by your consultant. So we'll have your bloods taken the day before, and before we prepare your treatment and release it, our pharmacist will make sure that your blood results are all within a required range to make sure that you are well enough to have the treatment. Next slide, please. So the pharmacist will check those blood results, and as long as they're within the required range, we will then prepare all of your treatment for you. Next slide, please. So we make all of the medication that we prepare, we make in our clean room. So we have lots of decontamination processes to go through before we get to the stage of making your product. So we will wash our hands with antimicrobial soap, and we will gown up appropriately. So we'll put a hairnet over our hair, make sure everything's tucked in. We'll wear an overcoat over our uniform. We've never been able to wear our uniform to work, so we wear a fresh uniform every day. We change at the hospital. The department supplies with antimicrobial soap to wash our uniform in, and we wash it at 60 degrees. So we get changed here, we gown up, we wear clogs inside the units. We don't wear our normal shoes inside the clean room. So we gown up and cover ourselves up as much as possible before we get into the clean room, and any gents that have got facial hair will wear a beard snood as well. Inside the clean room, we have all of our consumables, so all of the syringes and the needles and the infusion bags and everything we need to make your medication will be stored inside. Everything in that room is decontaminated as well, so it all gets wiped with a sporicidal wipe and then sprayed with 70% alcohol, just to make sure that everything is decontaminated and there's no chance of any risk of infection or bacterial growth on those products. They all get decontaminated before they're wiped into an isolator and then made inside an isolator to protect it from the outside. Next slide, please. So some things are really easy to make and some things are a little bit confusing. There's a combination of reconstitutions and dilutions. We make a variety of things just from an infusion bag, like the picture there. Some things go in a pump that the patient would wear and take home for a few days, and other things are just a straight syringe. But we'll prepare all of your items in the isolator, so it's a protected environment to protect it from any infection. Next slide, please. So once it's been made, you will have had a worksheet prepared that tells us how to make that product, and that's specific for you. So I have a label on it that will have all of your patient details on, the drug, the dose, and the infusion time. So the label gets attached to the product. It's then put in a heat seal bag to protect it, again, from any infection. And then it's sent out to be checked by the pharmacist. So everything we've used to make that product, the diluents, the infusion bags, any syringes, all go out and is checked by a pharmacist or a checking technician to make sure that we've made it right. All the batch numbers are recorded, so we've got accountability should anything happen in the future. The syringes are checked to make sure that we've drawn up the right volumes, and all the infusion bags are checked to make sure that we've put it in the right product in the first place. And then the product is checked to make sure there's no particles or anything marks on the bag. And then it is released to DCC or the ward for your treatment. Next slide, please. Next slide, please. Oh, that's the last one. Have there been any questions at all? I'm going to take that as a no.
Thanks so much, Hayley.
That's
That was
okay.
brilliant.
Oh, there we go.
Has anybody got any questions? I'm just going to share our thank you slide, and we're going to post some information in the chat, but please do keep posting your questions if you have any. That was really fascinating, and I think it's really important to be able to understand what happens when people's drugs are being prepared, and actually that it's not a very simple process, but that you obviously take a lot of care and attention. Let me just share. I'm going to share my screen with the thank you slide, and I'm hoping that Keith, you could share a link to Cancer Matters Wessex for us. If you do have any questions, I think somebody's got a question coming. Please, after this meeting, you can contact us on the email address below. That's macmillan.cancerinfo@dorsetccg.nhs.uk, and we will forward those questions to Louise, Mandy, and Hayley. Please do take a look at Cancer Matters Wessex. It's a really useful site to find information, and we plan to have a recording of this webinar available for you to find shortly. We know that if you are using Cancer Matters Wessex, for some people it's quite difficult to get online, and we do have access to the digital champions who can support people to get online. And I think, Keith, you're going to be posting some contact details for the digital champions for people to take away with them. We will be sending copies of these slides following this presentation, and we've got a link to our feedback form, and which we'd really appreciate that you complete, so that we can continue to develop content for you going forward. In the meantime, I just want to thank Louise, Mandy, and Hayley again for taking the time to prepare this presentation. It was really informative. It was really clear and easy to understand, and I think that was really key. So thank you both. Thank you, the three of you.
No, thank you.
Thank you.
So, Keith, have you got a link to the feedback, please, that we could post in the chat? Okay, so we've got that in now, I think. You should all have that. Thank you very much, all of you. And that's the end of our presentation. What we'll do now is we'll close the meeting and bid you a fond farewell and a great afternoon and weekend.